Transparency is the market-based buzz phrase of this decade in healthcare, and you're probably going to hear it for another 5 years. In the last 30 years, we've been trying to solve the healthcare cost dilemma using the American free market system. We've gone through DRGs, we've gone through managed care, we've gone through quality initiatives, we've gone through lean, and the latest market solution is transparency, and I'm all for transparency. And also I'm all for the free market system. I've lived in the free market system my entire life, and as we say here in Texas, it's been mighty good to me. So I have no problem with the free market system. However, there is a place in all the Medicare for All proposals, or the options, and this could be done without a Medicare for All policy, is some type of price regulation or negotiation on a government or a state level. Now, that sounds very anti-free market, but you've got to appreciate the fact that the basis of a free market economy is that each individual actor is incentivized to raise as much profit as they can. That's what the free market does. And then it's offset by the individual buyers making a decision, do I want to buy that or not, or do I want to go someplace else and find a better price? And that keeps the world in balance. We don't have that in healthcare. And there's precedent for the government at either state or federal level to step in and to regulate that. Since 1984, the Federal Trade Commission has had guidelines and rules around the funeral industry practices. It's part of the federal regulations that control what funeral homes can charge at times of a death, because they feel that the bereaved are at a disadvantage and have asymmetric information in buying funeral prices. So they have guidelines to keep this balanced, and it's worked, and there hasn't been a lot of complaints. Most states have laws prohibiting price gouging in times of distress, floods, fires, tornadoes, hurricanes. And you hear that all the time, that they almost all, I think about 15 don't, but most states have laws saying you can't raise prices for necessities above 10%, 15%. I would argue that people in healthcare have asymmetrical knowledge and are in distress. And we take care of that in healthcare because Medicare sets prices for hospitals and physicians, but they don't for pharmaceuticals. The Congress exempted pharmaceutical industry and so they can set prices wherever they want to. Medicaid has a maximum allowable cost provision for drugs. And so Medicaid controls pharmaceuticals, but Medicare doesn't. And then on the commercial side, the business solution is commercial insurers are to negotiate with health systems and hospitals to control the prices. That's where the field's supposed to be leveled, but we know from the RAND Health Price Transparency Study that hospitals are paid by commercial insurers 250% to 1,000%. So that system hasn't worked to date. And we know on the pharmacy side that pharmacy benefit managers are supposed to be the middleman to control pharmacy prices. But we know that that hasn't worked to date. The cost of insulin has gone from $74 a vial to $268 a vial over the last 10 years. So I think there is an argument and a place in there for some kind of middleman to step in, and maybe that should be the government, because insurance and the market has tried to step in, but it hasn't regulated that. That, along with transparency, may get to that. Now, transparency is very complex and it's hard to give prices, but I encourage you to look at the Oklahoma Surgical Institute.
Surgery Center of Oklahoma.
Surgery Center of Oklahoma, thank you. And go on their website, and I have no vested interest. I'm not a I don't own part of it, my wife doesn't own part of it, my children don't own part of it, my son-in-law doesn't own part of it. It's an interesting website, and you can go in there and put in what procedure you want, and the price comes up. If they can do it, it's not undoable. It's not because we're not smart enough. I think we're smart enough to not make things transparent.
They've also started